September is Prostate Cancer Awareness Month, and I think we would be pretty hard pressed to not know someone or love someone that's been affected by prostate cancer. There are so many different and always better techniques and surgical options. One of the options that's available right now is a radical prostatectomy, where the prostate gland is completely removed. And if that's something that you will be experiencing or have experienced in the past, physical therapy can be a helpful tool, and I'll explain to you why. So, if we walk through your anatomy, this is your urethra, the tube that empties urine from the bladder. Up here at the top, just above the prostate, is your internal urethral sphincter. This sphincter is not under conscious control, but it contracts to keep you continent. So that's your first stop block. Then you have your prostatic urethra that moves through the prostate. This is your membranous urethra here. This houses your external urethral sphincter, which is under more conscious control because it's surrounded by skeletal striated muscle. And that becomes important after surgery, and I'll explain to you why. And then you have your spongiose urethra that moves through the erectile tissue of the penis. After surgery, and again, this is not all encompassing, there are lots of different variations to the surgery, but the prostate is removed, and then that membranous urethra can sometimes be attached at the bottom of the bladder. When that happens, there are times when the internal urethral sphincter can either be completely removed, irritated, or damaged during the surgery. Again, not all the time, but sometimes. When that happens, you're going to rely much more on that external urethral sphincter to be your stop block and help to maintain your continence. And because that sphincter is surrounded by striated skeletal muscle, it can respond to strengthening. And it sits very closely, so it works in coordination with the pelvic floor, which is where physical therapy can come in and help. So before surgery, what we can do is to make sure that your pelvic floor muscles are working optimally to help support that sphincter. So we want to make sure not that you have good strength and good endurance, but that you also are able to relax all the way and lengthen all the way. Because if a muscle is really tight, the functional strength won't be as good. We also want to make sure that those muscles can coordinate and time very well with your abdominal muscles. This is going to help manage intra-abdominal and intra-pelvic pressure, which will take some of the pressure off of that external urethral sphincter and off of the bladder post-surgery. We want to make sure that your breathing patterns are optimal, that you're breathing the right way when you're doing things like lifting and bending, ensuring that you have good strength, endurance, and coordination in your abdominal muscles, in your glutes, in your deep hip muscles, and in your thighs can also help support everything and potentially make the rehab process after surgery easier. And then we tried to look and see if there are any bad habits or things that aren't optimal in your bladder or in your bowels. We always talk about bowels because constipation and straining can negatively impact things too. So if we see some of those things happening, we try to change that patterning before surgery, again, so that you don't have to worry about that after surgery. Now, after surgery, there is a huge amount of variability. So it's very task specific and it's very specific to the person. So we want to see, well, what are you doing well? What is good after surgery? And then what are you still having trouble with? We break down what you're having trouble with very task specifically, meaning we look to see why you're having trouble. Is it a strength issue? Is it a timing issue? Is it a coordination issue? Is it a combination of all those things? And then we can utilize strengthening, we can work on biofeedback, breathing, coordination, training to help all of those systems fire and work well together, not only on paper, but in whatever task you're doing that you're having trouble with. You may benefit from some bladder retraining, where we're teaching your bladder very gently how to hold larger amounts of urine over prolonged periods of time. And then we also need to make sure that constipation and straining is off the table, because that will negatively impact things after surgery. Now, there are a lot of people that don't need any help after surgery. So, God willing, that's you. But if you are still struggling, or you know somebody that's struggling, or would like to make sure that everything's working really optimally before surgery, that's where we can come in, and it can be really, really helpful. My name is Jessica Lockett. I'm the owner of Pathway Physical Therapy and Wellness in Boca Raton, Florida, and we are here to help you find your way forward. Thanks very much.